Good morning, good afternoon, or good evening, whichever is appropriate. My name is Andy Freiberg. I'm a pediatric oncologist with Penn State University College of Medicine in Hershey, Pennsylvania. I will be telling you about a medical student rotation that is best described as an elective in applied humanities. I will tell you about the rotation itself, as well as the qualitative research project in which we analyze the data from the rotation to show how we successfully taught humanistic principles to medical students in a clinical setting. We have no relevant disclosures. People ask me where I got the idea for the rotation. It originated from what I would do with high school and college students who would shadow me for a day. And what I did was first pair them with one of our patients checking in for routine chemotherapy. I would have the student shadow that patient and family before joining me for the rest of the day, because what I do is only a limited part of the patient experience. That became a very valuable part of the shadow experience for those students. So I thought maybe this would work with medical students as well. So we began this with our medical students in 2008. Rather than participating on rounds, write notes, and present patients, the students are relieved of clinical duties and spend most of their 2 weeks with a few patients and their families to gain insight into the patient experience with their illness and the medical system. A key part of the elective is narrative medicine, in which the students keep a journal of their experiences, and they're required to submit that journal to me as the course director at the end of the 2 weeks. The elective is pass-fail, as I never wanted the students to feel like their journals were being graded. These are the instructions we give to the students at the start of the rotation. If you're interested in looking at them in detail, I uploaded them to the conference as a separate PDF. I sit down with each student at the beginning of the rotation to describe it and answer any questions. And also I meet with them several times during the 2 weeks to debrief them and make sure they're on track. This is the specific instructions for the journal itself that each student receives when they start. This is also included in the handout that I've downloaded. I designed the rotation purely as a valuable student experience. Had no intention of doing any research on the journals themselves, but I often found what was in the journals to be so compelling that after 12 years and 120 journals, I, along with another faculty member with experience in qualitative research, recruited 4 preclinical medical students to analyze the contents of the journals. These students found numerous themes in the journals that showed how we were able to teach these students humanistic principles almost without realizing it. These themes involve the student, the patient, and the family, and the medical student itself. The themes we found in the journals encompass the 6 core humanistic competencies as defined by the Arnold P. Gold Foundation. These competencies are integrity, excellence, compassion, altruism, respect, empathy, and service. These are competencies we struggle to instill in students, especially in a classroom setting. What this rotation has done is managed to teach them in a clinical setting that engages the students. Now, the best way to illustrate how the students learn these competencies is by showing you some representative quotes from the journals themselves. So here are 3 quotes that illustrate the competencies of compassion and empathy. While I've been witness to this before, when you're a student rounding, writing notes, presenting, and getting caught up in all of the outside work, it's hard to have the time to think about what the patient and the family are feeling. And frustrated was the emotion I felt today because of my inability to do anything for them. Frustrated that I couldn't take away their pain, I couldn't stop their side effects, and I couldn't do much more than sit there. Frustrated because they have to experience this. And I became a familiar and friendly face in the hospital they saw most often, and that they could trust. I became a person from the medical side of his story who did not have to change her dressings or administer medications. They let me in to feel their emotions and openly shared their feelings during this life-altering time. This is because Above all, I learned to listen. Even silence told its story of exhaustion, of fear, of frustration. So the following 9 slides show additional examples. I won't read them all, but I encourage you to do so, maybe even reading them aloud. And as you do so, remember that they are written by third and a few fourth-year medical students. Keep in mind as you read these quotes, how these students step out of their traditional physician role and how they learn to listen to the patient and discover how healing is so much more than medicines and procedures. Here are 3 quotes that illustrate the competency of respect. This one illustrates here empathy. These 2 contain both respect and service. Here, respect and integrity. And here, altruism and integrity. And these quotes show the competency of service. And here, integrity itself. This is one of my favorite quotes, and in it I see many of the themes and competencies mentioned above. I will take even just a second to step out of the busy day and constant to-do lists to really look at these patients and try to put myself in their shoes. I will resist the urge to dehumanize them to a medical record number of a list of problems we need to fix. I will never forget that a little boy or little girl is fighting for their life in the next room. And I will never give in to the cynical and hopeless nature that plagues our profession. So this quote says so much to me. So after analyzing journals from this unique elective, we conclude that experiential teaching methods paired with narrative reflection may be a valuable and therapeutic tool to learn the intricacies of the patient perspective, with the potential to enhance humanism in students during a critical time in their medical training when empathy tends to drift. This rotation illustrates the impact of teaching humanities in a clinical setting and promoting humanistic education at a formative time, planting the seeds of a humanistic medical practice early on. From reading the journals, it's hard not to see the positive effect this experience has on students who've taken the elective. However, the results provide a moment in time perspective and offer no insight into the duration of benefit as students progress through their medical education and practice. Prospective follow-up with participants is warranted to evaluate whether the positive aspects of the elective have a lasting duration of impact or is simply a refreshing but temporary shift of focus for students. The students who took this rotation chose it. Many, but not all, had an interest in oncology or pediatrics, or had specifically heard about this unique experience and chose it on that basis. We believe, however, that similar experiences adapted appropriately would be valuable to students in other specialties, medical, surgical, or procedural. Indeed, students in other health professions as well would benefit from seeing more of the patient experience in their own specialties. We would, of course, love to see other institutions pick up this model. And while students new to clinical experience in their 3rd year of training may be the best candidates for this experience, there's no reason to think that students and even residents at other points in their training would not benefit as well. Please complete the evaluation. Here's my contact information. Thank you for your attention.